Welcome to Life in the Bricks podcast, where we talk to real people about programs that enhance our community so that we can build bigger and better portfolios while providing options for our residents to achieve self-sufficiency. I'm your host, Tony McGinnis, Executive Director, CEO with the Huntsville Housing Authority.
Welcome everybody to Life in the Bricks podcast. I'm Tony McGinnis, the host of Life in the Bricks, where we talk to real people about real issues that impact our community. Today, I'm excited to talk to Michelda Johnson. She has a story that I feel like is going to be an incredible show. She's doing some great things in our community. I'm not going to steal any of her thunder. So, Michelda, welcome to Life in the Bricks podcast. Thank you for joining us, and tell us a little bit about yourself.
Well, first of all, Mr. McGinnis, Tony, thank you so much for the invitation. Thank you for having me on. It has been such a pleasure to just see the amazing things that you are doing in the community as the executive director of the Huntsville Housing Authority and the changes that have occurred, all positive, right, for the community. So kudos to you and your team and the impact that you're making. Listen, introductions, I'm Michelda. At the end of the day, that's what it boils down to. Serial entrepreneur, strategist, really passionate about entrepreneurial development, passionate about community impact, and really passionate about people. And from that standpoint, it's really seeing people have the opportunity to maximize and walk in the full capacity of who they were born to be, whatever that is, right? And making sure that whatever access and resources that can be provided, they've got access to that. Native of Huntsville, most people know me as the Fruit Lady, opened the first edible arrangements in the state of Alabama, but now serving as the CEO of HAPPI Health, and really compassionate about our healthcare initiatives, about helping build a healthy and well community, because we know that when, as a people in general, when we're healthy and well, that capacity building then is a natural flow, being able to be productive citizens in society.
Man, that's awesome. And you know, one thing that I found out here recently about you is that you grew up in the Northwood community. And you know, Northwood is such a big community. How was it growing up in that Northwood community?
It was pretty interesting, right? So growing up, and let me put it in perspective, right? Because I want to make sure I'm very, I don't want to be disingenuous. So there was about a 2-year period that my mother and I, my mother's single parent, we lived on turf. And so if you're familiar with turf and the little roundabout that's right there at turf, our apartment was right there in that roundabout as you're going up. And so we lived 2.5 years on turf. But in general, my family, my great-grandfather, my great-grandparents had a home on Armstrong Street, which was in the Love subdivision area, which is really behind Northwood. And so my great-grandparents, from there to my great-aunt, my grandfather, and then when I was in the 8th grade, my mom and I moved into the house there. And so that was my community. Love subdivision, Northwood. That was my community. Went to high school, Butler High School. I'll never forget the blind man store, and our many, walks there to get candy and 10-cent candy. And, as a child wondering, how is he really counting my money? But if you know anything about the blind man, you didn't shortchange him at all, because he knew exactly, even if it was dollar bills, for some way he seemed to know if it wasn't right or not. And so having those opportunities in the center, playing and hanging out, basketball, all the things. For me, it was about community. As you grow up, you hear low income housing or those phrases that are attached to it. I don't think I ever saw that. What I saw were my neighbors, my friends, my aunts, my uncles, people that I know, family members. That's all I ever saw. And I saw a community that would always come and support and help and rescue and do whatever needed to be done to make sure that all of us collectively, as much as we could, remained in full supply.
You talked about the blind man store and, that whole neighborhood. I can remember that store as well, just from my time visiting my cousins who lived in Northwood and going to that store. Were those some of your best memories of what were some of the best times of growing up in Northwood?
Oh, those were some of the best memories, right? It was hanging out after hours. It was doing, and my earpiece is falling out, but it was hanging out after hours, playing long after the street lights came on. Mom is trying to figure out where are you when to get home. And one of my best memories, and if you think about it today, it is what it is, but I used to walk to Butler High School. And so if you think about that walk today, I mean, even I was sharing with my daughters that walk one day, and they were like, Mom, that's far. And I'm like, nah, that was fun. Of course, we crossed over University and walked down through Terry Heights and, made our way over to Holmes. But those memories of walking back and forth to school, for me, I enjoyed them. I had fun. We, ride our bikes and, do all the things. So it was just fun times. Carefree, fun
Yeah,
times.
yeah. I can remember now that you said that. A lot of my friends who lived in Northwoods, because I went to Butler as well, they would walk home, and never really thought about that until you mentioned that. And I'm like, man, that was a hump, especially on days when it was cold. That's not like a quick walk. People need to understand you walk through what 2-3 different neighborhoods just to get to school, man. So that had to be, you had to make it fun, or it was going to be torture, because that wasn't an easy walk.
It was not an easy walk. And if you're familiar with Holmes, I mean, it's got an incline there. And so you're getting some good exercise, that's for sure.
Exactly. So, what do you consider being in that neighborhood? And I was just a visitor. I grew up in Sparkman Home, so my auntie and my cousins, they all used to live in Northwood, so we would frequent that neighborhood. But what do you think some of your worst memories of that neighborhood would be?
I don't think I have many bad memories. There were moments and times that there were moments and times that whether it's a fight or some sort of event that required police involvement, that you kind of like, oh, okay. But as far as any really bad, worse moments, I struggle to come up with what those would be. Other than because back then we didn't as much. We were hands. We were fists. We weren't shooting it as much. And so, you might get into a good fight, or you realize that there were family groups. So if you think you fighting one person, you better guess again, you fighting the whole family, because they all coming for you, right? And so, being able to, navigate that, I can't particularly think of at any one moment that I would say was a negative or a bad experience or anything like that for me.
And a lot of people who grew up in the neighborhood, and I asked whether it be any neighborhood in Huntsville, especially late 70s, early 80s, early 90s even, they have the same sentiment, right? They remember the good time because those were times when families who lived in a neighborhood were family. Either you had immediate family or your neighbors became your extended family. I tell people all the time, there are a lot of companies and organizations who come into communities now and they think that they're teaching us how to be good neighbors or to be family. But the one thing we knew even back then was how to be family. You got into a fight with somebody in the morning, y'all would make up by the evening and you would be back friends. Even the adults, they would have their spats from time to time, but at the end of the day, we were family. We might fuss and fight with each other, but ain't nobody else coming into the neighborhood and gonna create any problem. So, it's funny because a lot of people say that same thing, that they can't really remember a bunch of bad times, which leads to helping us understand that when you build community right, whether you're rich or poor, whether you're living in public housing or outside, when it's done right, kids don't even see the difference. And that's important because we got to learn how to get back to that, how we can build community where everybody feels like their neighbor is looking out for them. If there was something, from your childhood and growing up in that area that you would change or you would add to, could you think of anything that would be?
I don't know if it is now, but all I think about is the walking back and forth to school, right? So there's a part of me that always asks the question, why didn't we have bus service, right? Why didn't we have a form of transportation for a community that may or may not have had adequate transportation? Or you got mom and dad that really need to go to work, and that work time starts way before school starts. So, how do you ensure that your kids are at school on time? So, if I could think of anything that I've, always questioned is like, why was I walking to school, right? Why wasn't there transportation for a community, especially a community as large as Northwood, right? Then that would be my question is, I think we failed in that area of making sure that we were providing adequate and resources to all, and ensuring that there was access. That would be, one of the things that I would say we really should have improved upon is just making sure that from a standpoint of, because, if it rained, guess what? I walked to
Yeah,
school, right?
yeah,
So
yeah.
it was no option, right? Unless I wanted truancy.
Right,
And I got a paddling or two at Butler High School, but it wasn't for that, for running my mouth. But talk too much was my thing. But you wouldn't want anybody to miss out. And so that would be the thing that I would have, if I could go back and say, why didn't we do this? That would
yeah,
have been the thing that I would wonder why.
yeah, yeah. And I can remember I guess by the time I got to Butler, there were community vans that, you paid a little fee, they would take you. And so the communities tried to get hip to that. And I think there was a rule in place that if you didn't live, I think it was at the time, may have been 2 mile radius or a 3 mile radius within the school. The school system didn't have to provide transportation. But I know that there was a distance, and I'm still thinking about this. There's no way that what we did some stuff back in the day that we would cringe at when it came to our children today. Even as a freshman, I couldn't imagine a freshman who lives in Northwood having to walk all the way to Butler right now.
Yeah.
That would just blow my mind. But do you being that you've gone, you've been you are successful, you've had successful endeavors where you're taking Happy right now, and to think about the genesis coming out of Northwood, would you have any advice that you would give a resident who might be listening to this podcast later of, holding on, just persevering, what would you give to a resident who's living in public housing right now?
I think my biggest advice would be, and I hope it doesn't sound cliche because I do mean it sincerely, is that, we understand in general that we have to work harder, all the things. But I also know that there is hope, and there is a opportunity that, if you desire, and I always have to caution that with that, because some people are where they want to be. So this isn't for those that are saying, this is where I want to be. This is a community to me that I want to, this is my family. I don't want to be anywhere else, right? But for those that really are saying, I feel stuck. I'm not sure this is where I imagined I would be. Then my thing would be to really reimagine where you want to be and discover the steps on how to get past that. And so sometimes what happens, and this is what I've learned in life, right? Sometimes what happens is if I imagine the bigger picture, then I start to imagine the steps that it would take to get there. It overwhelms me. And so the next thing I do is say, that's just too much. So let me just sit and not do anything. That's not the answer. And then sometimes we're trying to figure out, how do I get from point A to D? And I got all these steps in between, and I can't figure out in my mind how I'm going to make all of that work. That's not your role either, right? I'm always reminded of Peter. Y'all know my nickname is the water walker. I'm always reminded of Peter stepping out of the boat, right? And in being reminded of that, it's just one step. And so what I would encourage any individual is to say, or to ask yourself, what is just the next step? Don't get to the next 10 steps. What is the next step? So then the next step may be, my goal is, I don't know, I want to be an engineer, right? Okay, so the next step may be, shoot, I don't have my GED. Okay, let's get to the next step. So then the next step is, how do I get my GED? Well, I'm glad you asked, because I'm sure Mr. McGinnis can tell you exactly how to do that. And the classes and things that we're going to be providing at Calvary flow right into that. Or the next step could be, got that, I'm not sure how to fill out this college application. We can work with that. My point is that sometimes we get overwhelmed in trying to figure out all the things that we begin to talk ourselves out of things to say, there's no way this is going to happen for me, because you see the past, right? But my challenge for you is, don't look at all of that. Just look at, what's the next step? And if you're struggling with the next step, find you a mentor who can help you see the next step. Because sometimes when I'm in a hole, right, when I'm in the flood of my own stuff, my own junk, when I went through a very tough experience, and I'm using this as an example, 2025. So I felt like I was in a fog. I couldn't see clear, right? So when you're in a fog, you can't see clear. But guess what? The best thing is to find somebody who's not in that fog, who can help you see, that can help you design your next steps. So sometimes we're talking ourselves out of things because we can't see it. And my encouragement is, don't talk yourself out of it. Just figure out what's the one step. Here's what I know. I didn't imagine that I would be the CEO of HAPPI Health. Wasn't on my blueprint, wasn't on my plan. Let me go back even further. Growing up in Northwood, Love Subdivision, my North Huntsville community, I never imagined I would be an entrepreneur. That was never on my plan. It was never there. Here's what happens though. Step A leads you to step B. Or you make a decision about something, you carry through with it, it leads you to the next step. then guess what? Something else comes up. It leads you to the next step and the next step and the next step. And if you keep moving, what you'll find is as you begin to move and grow, capacity expands. And before you know it, you're really in the middle of where you're supposed to be. I mean, Tony, I could ask you, was this what you thought or where you thought? Right? But it's a series of yeses, just one step at a time, that really leads you to a place that you probably have never dreamed of. But you got to take the one step.
Make sure y'all are taking notes, man, because that was a masterclass in moving from where you are to where you want to be. And I'm glad you mentioned that, because with the programs that we're going to get into a little later at Calvary, we're going to have all the resources that you need for that next step. And I'm talking about the Envision Center that HAPPI Health is going to be a part of. But I really appreciate you sharing that, because there are going to be some people who listen to this who think that they don't have the skill set. They don't have what it takes to get to point Z. But we're not asking you to get to point Z. Let's get to point B. Let's take the next step. Let's get out of the boat and touch the water first. You know what I'm saying? And so if we do that, then I was just thinking about this today. The God we serve, if he gives you the vision, he will make the provisions for you.
Always.
And so we don't have to have everything in front of us. We just need to get out the boat. So as we dive into Calvary Hills and what's about to take place over at the Calvary Hills Center, HAPPI Health is going to be a very instrumental piece in helping us build something over there that I'm super excited about, because I don't think it's going to be anything like this in our community that's going to be specific to serving our residents and our community. The Envision Center is one of those things that's been on the plate for a while. Now we're able to move in a way that's going to bring a tremendous amount of services to the community. But the one that I'm really, really excited about is the healthcare piece that we're going to be able to bring to the community, that's going to eliminate a lot of hurdles, a lot of barriers. So talk to us about the partnership that is going to be taking place here pretty soon in North Huntsville, in the Calvary Hills Center, and what you all are going to be able to do to provide services over there in that community.
Thank you for that. Before we seg into that, I just want to mention from that prior conversation, because sometimes what happens is individuals will see you and I in this setting and say, well, you ain't really went through nothing, or you had it all laid out, or you had this, or you had that. And even if you lived where you lived or did what you did, I want to say to anybody who would not believe the story is a lot of people don't know. I've written about it in a book, but I was homeless for a period of time, and my shower was the gas station bathroom. Okay. My food, I fell in love because I had no choice. Forever grateful for Long John Silver's, because at that time, early 90s, Long John Silver's had a $1.99 meal. And so if I couldn't do anything, I knew how to scrape together. I love when y'all be dropping coins in the parking lots of the gas stations. Okay. I could scrape together $2 to get me a fish meal. At that time, you could get 2 pieces of fish, some fries, and a drink for $1.99. So don't let all of this or any of this fool you. I know how to survive, and I've also been in places where I didn't think I would ever survive or come out of. And so if I'm telling you that you can do that, It's not from someone just telling you something to be telling you something. It is from a place of this is something I've experienced and something that I know for a fact can happen. Okay.
And
Let's talk about.
let me say this, because it's so funny you bring that up, because as we were promoting this show, there are some people who said something about me, and I said I wasn't going to address it, but people don't know what they don't know. And I'm not going to go into detail about my story, and, you know, but when you live in our neighborhoods back in the 70s and 80s, and you made it and you've gone through the fire, the people who know, they know. And so the naysayers, they can be on the sideline saying whatever, but the people who know, they know. And you don't live in that, and you don't brag on that, because I'm sure none of us wanted that. When I was in college, I used to tell my friends who wanted to be from a tough neighborhood, I'm like, no, you don't. Nobody wants to live the way we had to live. So be grateful that you grew up in a white house with a picket fence, literally, because those are the things that help you become who you are. Where I grew up helped me become who I am. So yeah, I'm glad you shared that.
Yeah, it's so important because you know people, and what I realize is, and Tony, is that it's not really necessarily, it feels personal. It's not necessarily a personal jab. What it is though is that when you're in a situation and you're not moving out of it, the harder part of that next step is that you've got to hold the mirror up to your face to say, what am I going to do? So everybody gets a choice. You can decide I'm gonna stay, or you can decide, but the only person that's giving you the accountability on that and the reflection of that is looking at you in the face
Yeah,
when you hold up that mirror, right?
yeah.
And so when they see somebody, it's easy to say, oh yeah, but you had, you know, and you got,
Mhm.
and you got this, and you got that. You listen, don't let it fool you. But you know, my mama and I, we have a funny story that we always tell, because I was going through a divorce and really didn't have no money and was renting a house from my mama. And I didn't pay her rent for 2 months because I felt like I couldn't afford it. But guess what? I walked out one Sunday morning to get my Sunday newspaper, and a for rent sign was in my yard because my mama had come in the middle of the night and said, you don't pay me, you don't live here, go find somewhere else to live. It's life, right? So
Mhm.
it built something in us, and it built something and so what you experience is not for you to settle in that place, but what
Mhm.
you experience is for you to take the lesson and grow from it and begin to groom yourself into something next. Let's talk about happy health at Calvary, because you will get me excited on this topic right here. So I want to revisit your question about happy health at Calvary, and really the vision for that. Um, uh, Happy Health, and for those of you that don't know, we are a federally qualified health center. We're a community health center. And with that community health center, HRSA is the governing agency. We see all patients regardless of health insurance status. We see patients that have insurance, they have commercial insurance, they have Medicaid, they have Medicare, Blue Cross Blue Shield, TRICARE, whatever that is. We also see patients who have zero insurance, and we are able to see them either a sliding fee scale, sliding fee basis, with a small copays, and that's all that they pay, or they don't pay anything, depending upon what their financial status is. We don't ask, we only ask the questions that we're required to ask. And so then the next question I usually get is, but is the quality of service the same? And absolutely it is. We have a wonderful group of providers, led by our chief medical officer, decorated retired military, Dr. George Kyle, who are really passionate about who we serve and the demographic, right? Most of our patients, more than 70% of our patients are 200% or below the federal poverty line, right? And so with that, we are able to serve. So for me, what I love about being in Calvary Hill is that we recognize that some patients, we talked about the buses for us growing up, but some patients don't have transportation to get to their healthcare appointments. They don't have transportation to get that flu shot that we keep telling them that they need, right? And fortunately, in all of our locations, we're on the bus line, but sometimes that can be very inconvenient. And because of a patient's health conditions, comorbidities, whatever that is, it's inconvenient for them to keep those appointments. So to be a health center in the middle of a thriving community is a game changer, because it allows, and it basically says, we're bringing healthcare to you. We're bringing it to your front door. We're bringing it to the place where you are so that we can make sure you get what you need. That if there's prescriptions that need to be refilled, if there's screenings that you need to have, if it's monitoring your blood sugar levels or blood glucose levels, right? And so now as we become a part of the fabric of the community, and let's be clear, this is for adults and our young babies and our pediatric patients. And we know when our pediatric patients and our kids are healthy, they do better. They perform better at school. When they're healthy, their minds think better so that they can do very well in their math and their reading and the language arts and all of those subjects, right? And so the goal is about keeping a community healthy and whole to help promote whatever forward development we have for that community. And so bringing those resources, I think for me, it eliminates the barriers. It eliminates the, I can't get to the clinic. It eliminates children going to school sick because they can't make it to a clinic in time, right? And that's what our goal is, to really become a partner in that community, to have providers who are passionate about the health and wealth of the folks in Northwood, and to make sure Northwood, and to make sure that we are providing quality services for the individuals, right? So I'm excited about it. I think it's new. I think it's fresh. I think it speaks volumes for for your vision, and your vision even within vision, that not only do you get quality healthcare, you get training, you get development, you get resources, you get tools. It just speaks volumes about you, Tony, and your passion for the community. And I'm just honored to be a part of it.
Yeah, you know, I just, when I think about it, and for those who are listening and will go back and look at this, if you don't know about HAPPI Health and where they have gone within the last year, 12 months, go look at it. Let me tell you, the eye opener for me was this Christmas when you had your HAPPI holiday event.
Santa Comes to HAPPI.
Santa Comes to HAPPI. And it was so many people that showed up at the Calvary Hill Center. I mean, there were people all in the gym, all in the classrooms. I mean, it showed the level of work that you all do. You just don't go out and pass flyers out and get that kind of crowd. That's based on years of just working together, the community just understanding that they have a friend in HAPPI. And so I'm excited for what it's going to do for our residents out there, because anytime we can eliminate barriers to people being healthy, it's a game changer. And so thank you for being willing. And that's another reason why it's so important for us to connect with those folks who understand our community so that we can provide resources, because now it's not just something else you're doing, it's something else that you're doing because it's a part of where you are. It's a part of your fabric. So I can appreciate you being willing to do that.
I'm excited about it. And yes, our Santa Comes to HAPPI event, man, we bought toys for well over almost 1,000 children. bicycles, and I'm always forever grateful to our donors and our partners who help us in doing that and in closing that gap. But it also, you're right. I mean, and here's what I'm looking at from 2024 to 2025, an 11% growth in patients, 11%. We now have well over 12,000 patients, 37,000 plus visits, and we see that steadily climbing. 4 locations in Huntsville, just opened another location in Decatur, Alabama. Calvary slated to open April, May timeframe. The other thing we're adding to our suite of services is a pharmacy, where we can still offer the sliding fee scale for medication. A part of it is we see where we write the prescriptions, but patients can't afford to get the medication refills, and so they don't, right? Mm-hmm. They fall out of compliance with medication. So now this gives us an opportunity to work with patients at their level to make sure, we've written the prescription for insulin, but now we can help you get the insulin so that it is cost effective and within the confines of what we can do. So this expansion is really all about access for our community. And it really makes a difference. It really makes a difference. And the other pieces of it is we see folks struggling to buy groceries and all the things because of the increases in pricing. To be able to still go into a doctor's office, we take walk-ins every day, all day at all clinics, and to get what you need is pivotal.
So one of my last questions would be what do you see the immediate impact on this community being by, in addition to eliminating barriers, but when you talk about a health perspective, what would be a benefit from having a clinic right here in the neighborhood?
I think the immediate benefit is going to be the access to really get what you need. We do, we've already did some of the data checking, and many of the residents are already patients, but we know some of them are not able to make those visits. We have one gentleman in particular who we know it's a struggle. It is a challenge for him to get to our clinic location, right? And so one of the most excited patients that we have that we'll be opening up, and for him, it's just a wheelchair ride down the sidewalk now, versus trying to figure out how to get somebody, fold up your wheelchair, get in, do all of the things. It's just a wheelchair ride down the sidewalk. Those are things that are immediate impacts. And then the other pieces of it is that'll be a vaccine center. So we'll be able to do the immunizations for kids. So the back to school, the sports physicals, all the things that we find that our pediatric patients need, we'll be able to, immediately look at the runny noses and all the things and give relief to those parents. And we're also looking at, what should the hours be at that location? Traditionally, we're 8 to 5, but we've been testing for the last year and a half a 5 to 8 model, 5 p.m. to 8 p.m. model at our Sparkman Drive location. And we're finding success in that model, in that parents need to go to work, kids need to go to school, but then they want those appointments. And so our evening clinics have been packed. We're looking at all of those options so that nothing is off the table. And so what I would submit to anyone that's listening is give us your feedback. Email me at admin@HAPPI Health, happy with an I, happyhealth.org, on feedback of when should we open, or what should those hours be. We are very open to what the community would like to have.
And that's awesome. I mean, it really is. It's going to be a game changer. I appreciate you being on our show today. The information that you have been able to share has been very helpful. For those out there who are going to be listening to this, please share this on all your social media platforms. And if you haven't had an opportunity to, once again, look at HAPPI, please go do so, because they're doing some great work in our community. Is there any last words, parting words you want to share with us as we close out the show today?
You know, you started a fire inside of me, and I'm sitting on the edge of my seat. So the only last minute words that I would share with you, and I want to look you dead in your eye and say, take the next step. It's waiting on you. You're not waiting on God. You ain't waiting on Tony. You're not waiting on the city. You're not waiting on anybody or anything. Look in the mirror and realize you are strengthened, you are purposed, you are called, you are anointed, you are everything that you need to be in this moment to take the next step. I double dog dare you.
You heard it here. Life in the Bricks podcast. Michelda, thank you for not only what you're doing in our community, but for being a game changer when it comes to healthcare in our communities. Your leadership has been tremendous. You've taken that organization to another level, and I'm just happy for you. Excited about what you're going to be doing in the future. This has been another great episode. What a way to start the year out with a podcast like this. So I'm grateful and I'm thankful. Please share this on all your social media platforms again. And again, this is Tony McGinnis with another great episode of Life in the Bricks podcast. Thank you.
We've come to the end of the podcast today. Please share the link on all your social media platforms. We hope that you all will join us again next time. Until then, keep serving and keep pushing. This has been another amazing episode of Life in the Bricks podcast. Peace.